Hi everybody, I'm Dr. Qazi. I'm a skin restoration specialist in Newport Beach, California. I focus mostly on acne and scars and pigmentation. I do a lot with collagen stimulation as well and facial balancing. I have this photo up here because this is something I worked on a lot. This week was temple scars. A lot of patients had really thick, deep temple scars, and they were kind of worried about the fact that they were told before that they couldn't really do much for their temples. And I want to showcase actually for you guys that there's a lot of different steps that we could do to really get excellent results for the temples. It's not as daunting as people think. It's not as as difficult as people would say. And the other thing that's nice about the temple area is that it's an area where if you get it on time and if you start breaking up that scar tissue, you really can get a little bit of a faster collagen response. A little bit of volume there goes a long way. So it's really an area that I actually like to treat. It's an area that like people seem to like really suffer from. They find that they're really self-conscious, especially a lot of guys would say that they can't cover it up with their hair, and they have to have certain kinds of haircuts in order to cover up. And it's like, they were kind of stuck for a long time with their temple scars until we ended up doing things like this. So you'll have a lot of patients, they'll tell you that over and over again, that there weren't really many options that they thought that they could do. But here we have, just some of the ways. This is 1 year later for this patient. You could take a look and see here. Hi, Mrs. Jones. How's it going? Good seeing you on. This is one of the different things that we do. Today, I did a patient with some thicker scars along the temple, but on like Monday, there was like really thick scars, and she had gotten subcision twice over there. There was still so much scar tissue. And it's unusual actually because the temple is actually an easier area to treat. People were asking yesterday about the temple scars on the live, and I wanted to get back to this because it's just like one of these things that it could look killer. It could look awesome when we get it done. If you just give us a few steps and we'll take care of it there. And I hope you're doing well, by the way, Mrs. Jones. Good seeing you on. Ms. Griselda is saying, do you recommend microneedling and CO2 in the same session? Will we get good results? I don't know what it will be doing really with the microneedling and the CO2. The CO2 laser, potentially if they're trying to do it just like deep and then they want to do something superficial without much heat, maybe that's what they're trying to do. What's your skin type? Maybe that's why, because if it's like Fitzpatrick 4 and above, maybe that's what they were trying to do. But I'm not entirely sure. I'm not entirely sure what the thought process with that would be. Doris is saying, I had an acne scar and Bellafill was injected years ago. I now have a nodule. Does cold laser therapy help? That's a good question. There may not necessarily have to be cold laser therapy. Sometimes you could do steroid injection. What we want to do is we want to take a look underneath ultrasound to see is it truly a nodule, if it's just collagen buildup, what exactly is happening with it. If it's just collagen buildup, you actually could just do steroid and potentially 5-FU. That's something that could work out pretty well. So steroid and 5-FU, that actually works out pretty well. But if it's really is truly Bellafill, then you could actually do some subcision, just do some of that as well. And then sometimes you could actually do something like radio frequency microneedling, or you may actually end up doing something along the lines where you could do a CO2 laser to smooth out. Did you say this was one session? This actually was a session, one session for this patient. This patient was one session here. This was with over the course of a year for him. And in his case, we did TCA Cross, laser, and then Bellafill here. Let's see here. I guess the son is saying, does TCA Cross cause more scars and make it deeper? Please help. Well, I did TCA Cross on this patient. It didn't do that. I do like almost every single patient that I showcase on here, I've done it, and it's not making it worse. There's just ways of doing it so we can do it really safely. It's just over and over and over again. I do it so often. I just got to make sure it's very careful. We change the concentration depending on the depth of the scars. And it's like, in the temple area, you don't want to go with a really high concentration. The nose area, you typically don't go a very high concentration. Just in general, like it's just like you gotta be really careful as we're doing this, and that's how I do it. You just gotta go really careful without too much acid. Let's see here. Someone's asking, hi, Dr. Qazi, how long does tretinoin take to see results? What are you trying to use for? Are you using it for acne or for scars? Lucky Singh, good seeing you on, by the way. Hi, Dr. Qazi. Sorry if this is a repeat question. After years of treatment, my skin has become extremely painful. Wind, sun, cold, sunscreen only. The only reprieve is moisturizer, and that lasts maybe, I think you're saying 5 minutes. Well, you may actually have a bit of rosacea. It's possible. There's some sort of sensitivity to really like that has been undiagnosed. It's possible that underneath it really, I think you did some lasers if I remember correctly. Sometimes it does get a little bit triggered, and a lot of times you actually have to be on sometimes like topical antimicrobials, which it could involve something like topical metronidazole or like ivermectin potentially. And usually you want to avoid more exfoliants. So that's kind of typically what I end up doing if it is really truly like a rosacea pattern there. But Lucky Singh is saying, my questions are, why does it hurt so much? And is there anything for the pain? Thank you so much for your time. Appreciate it. So yeah, so you said, Lucky Singh is saying he did a lot of lasers and that's what caused it to be so sensitive. So a lot of lasers sensitive. You want to just make sure that the skin is healing. You sort of treat it though as similar to rosacea still though. And we want to get it so that there's a lot of products essentially that we could do mostly with Vanity cream, sunblock, and then occasionally if you need to, if it really is truly something that like there's these little microbes that could make it worse, you could do something like metronidazole, for example, which can end up helping, and it's a bit anti-inflammatory too. Liz Strauss is saying, are there other people doing what Dr. Davin Lim does besides you in the United States? Dr. Mark Taylor is somebody who's been doing it for a long time. He did the Taylor Liberator, and I think he tends to do patients who are Fitzpatrick 1 through 3, as far as I understand. He's over in Utah. I do all patients, but he's excellent at what he does, and I do Fitzpatrick 4 through 6 like a lot. I do like most of our patients are darker skin type. So there's not many people though in the world who do this. There's not many, but there are a few people who do it very, very well, and you can feel comfortable and confident depending on the kind of scars and your skin type. How's it going? Keep It Zen. Thanks so much for coming on. Appreciate that. Keep It Zen is saying, wow, it's so much better. It is so much better. It's just like this is a 1 year later result there too. So it's just like it's awesome to see there. Where was I? I know I missed a bunch of questions here. Let's see if I can catch up with them. Could acne scars ever be 100% gone? Don't know. I don't know. It depends on like how deep the scars are. Like some of these scars, some of them are completely gone, but some of them are still visible. So it's tough to say exactly if it's like completely gone or what we're trying to achieve. I would say just don't focus on it too much, like completely gone. Just look at it instead that like this is something that's not visible. It's very, very hard to see this now. This is really with harsh lighting that you can still see some of this lighting, some of the scarring, but in normal light, it's hardly visible. Actually, in fact, one day I should showcase to you guys, like you should see that these are this is harsh lighting right here. And then you can see like what it looks like without that kind of lighting, with a regular day-to-day lighting. And you'll notice that it's really not too visible. It's just that a lot of people would say that, okay, I don't like the fact that, in many types of forms of light, the angles, things like that, it really disturbs them. And that's why I try to get it so that I'm making sure that even with those harsh lights, we're still making it so that it's really minimized. Do you do free consultations? Our consultations are $150. They do get applied towards your treatment. You just go to drqazi.com and you can set it up that way. And just do it that way. Ganesh is asking, Doctor, how to minimize the black marks in the side of those scars? Then those scars will be completely clear. Are you referring to just hyperpigmentation? If it's hyperpigmentation, you could do a Pico laser. You could do peels. That's actually pretty easy to do. Actually, it works really, really well. Lucky Singh is saying, thank you, Dr. Qazi. No one has been able to answer that for me. Again, thank you for your time. We are also grateful for your knowledge, help, and free time. Time with us is time away from your family. Appreciate it. Fortunately, my family has been really, really supportive. Everybody knows this is a time period. And then I always say to people, like I was talking to one of my patients today, it's just like one of the key things that I like to do is just that when I do spend time with anything, I just like dedicate it to that. So it's like, here I am with this. So I'm not like sitting there looking at my phone, and I try to do the same thing with my kids. It's just like, I'm just going to be here and just be fully engaged. And like whatever I'm doing, it's just, that's what I view it as. Like whatever I'm doing, if I'm going to do it, I just want to be like fully engaged at doing it. And that's why I feel like I don't like miss out on stuff too. I think that there's a lot of stuff that people miss out on with their kids and like with their family. And it's partly because they're just like so distracted with like their phones and social media and, TV shows and everything else. Not to say that you shouldn't do that. Like, obviously you have to do some of it, but like, I find that like, it just gets really distracting and can be overwhelming for people. And, it could be really difficult for like the family. They don't see you enough. And then you start like sitting on your phone all day. Let's see here. Sailor Moon saying you sound like a great father. Or thank you so much. Appreciate it. Have you ever gotten lumps from Bellafill? I have not actually run into it. I have seen it before in other practices. I'm not too worried about it though, because honestly, like not that, I mean, obviously I want to avoid it at all times, things like that. But, when I had actually gotten my face and originally injected a bit with Bellafill, there was like some mild like lump that were there. And I was able to massage that out pretty easily with just like warm compresses, and it would massage down. And it was like really, very easy. And then when I take care of like patients also, essentially, like let's say that we're working with them and they've gotten it done elsewhere, and some Bellafill, and they have had some Bellafill lumps, which is really rare. It's gone down actually, just a little bit of sometimes saline with massage, sometimes with like a steroid, and like that's it. So I haven't ever run into a problem where it's still been stuck. SMB is saying, hello, Dr. Qazi. Do you do anything for hooded eyes? Actually, I could show you a really cool result actually with hooded eyes actually that I did with laser. A lot of patients really need surgery, but some people that just for whatever reason they opt not to do that. I'll actually try to find it. I don't know if I could pull it up tonight, but I'll see if I can. It'd be pretty cool actually. Are acne scar treatments covered by health insurance if the person is severely depressed? You should try it. I mean, I hope you're getting some help for your depression though. That was my whole theme this whole month with mental health awareness. It was like very, very obvious. It's very clear to me that there's a lot of people suffering from their scars. It's very, very clear. And I think that you have to look at it and see like kind of holistically what are other reasons why you may be depressed, and see, I mean, of course, this could be something that's contributing to it and making it worse, but see there like how you could solve those other aspects too and really work through it, because I think that you shouldn't really neglect that mental health aspect of things for yourself in terms of counseling. Just try to get like just behavior modifications and just like a group therapy, group sessions. Try to really work through this with other options, because it may not be that like the acne and the scars themselves are like the root cause of your depression. It could be that there's a lot of other reasons why, and it needs to be solved. And if you don't get it solved, it's just going to keep on accruing. The way like anxiety and depression works, and like even allergies and a lot of different things, basically like it's always there. There's like basically, let's say for allergies, for example, you have like pollen allergy and mold allergy, and like it's just like kind of like hanging out. And you also happen to have an allergy, let's say, to cats. And now you have gotten a cat, or a friend brought a cat over, and now everything, your pollen, your mold, and your cat allergies have now just skyrocketed. So that's what could end up happening sometimes with patients with anxiety. Let's say that they're like stressed about work or stressed about family, and that's sort of like under control. But then on top of it, they ended up getting some acne, or they got some scars, and now it's like everything started like skyrocketing, and now it feels like everything is just like out of control. And then it ends up being really, really like a lot of patients could suffer a lot more now, because now it's not just the acne and the scars that are they're really stressed out about. It's also now that they realize that everything got pushed over the edge. Their family life with stressors, the work stressors, everything just got really, really difficult for them. So just solving the acne does help, because maybe the other two things could be managed, but still they're still like there. And so until you kind of get those things under control, this could always end up like something else could trigger your anxiety, your stress, and potentially push people over the edge. So, that's like, pay attention to that, because it's not just like a one thing. It's like a lot of times there's like a few different factors that are really kind of pushing that chart up. And it's, normally you would do a good job keeping it under control. You're like doing really, really well in life. And then one day it's like suddenly you got a terrible scar on your face, and now it's like everything just like starts to feel really terrible for you. And it's like now, I would be happy to help out with your scars, but there was still something underlying there that really pushed it above there. And I would say that same thing for myself. I was fixated a lot on my acne and my scars, but it was like I was thinking also at the time though that like it was really stressful with school, really stressful to like make sure I was doing really well and to become successful in life. I really, really wanted to. And it was like it was difficult. Really, it was difficult to kind of manage that. And then on top of it, I had acne, and then on top of it, I would eventually have scars. And so now everything kind of got pushed over, and it just felt like it was just like it was difficult to manage any of those things then. So that's why I kind of wanted to get this acne under control, because it was one thing that at least I could tackle like right away. But just see, ultimately that if you do tackle that one thing, you may end up having those other problems like skyrocket still. So keep an eye on that. Just because we solve the acne and the scars doesn't mean that the stress and the anxiety doesn't get resolved. And in fact, these things are these treatments. These are emotional roller coasters for a lot of patients. It's a slower process than people may expect. There's a lot more healing involved than people might expect for certain things, and it could take a little bit longer. So it could go up and down, and you have to be pretty strong, like mentally, to be able to do that. Let's see here. I guess a star is saying, my NP microneedled me with topical insulin and my scars are almost gone. Have you heard of this? I have heard of that, and I have not seen that that's something that's like a long-term solution. And the other problem is that anything with with insulin, it's really, really risky in my mind. I'm not sure exactly what they were doing with that per se, like how much of a dose they were using. I've seen like it was like supposed to be like a really micro dosing of it. I do it myself with like Botox, or like just like a puncture, and I stamp it for some sort of Botox or Dysport, and that's just like, it does help. It's just a temporary effect. And I got to go through the exact mechanism for what it was with insulin. It's been a while since I saw that, and I haven't really seen anybody else looking at that. But I'll take a look and see for you, and see if I can get you a good answer for that. And talk to some people who do scars and see what their thoughts are. Tony Gilman saying, what do you do for acne scars on the neck? Thanks so much for that question, Tony. That's actually a pretty tough area, really. I had some other photos last week where I showed the neck area. That does usually need subcision because you can't do too much heat and too much energy there. But I usually use blunt cannula subcision for that, and I don't want to use too many like sharp tools. So I do that, and then lower heat, lower energy lasers, plus a little bit of TCA Cross. So that's usually what I end up doing. Srijan is saying, hi, Dr. Qazi. I'm actually booking a flight to SNA after consultation right now. Awesome, Srijan. I appreciate you. SNA is the greatest airport in America, by the way, guys. I'm not like paid by them. I'm just telling you, it's a really, really great airport. You'll see it's like just easy to hop on and hop off. You just like go walk right through there. They're like, it's amazing. You'll see. It's just like, you just go on, and like, it's just, it's like your own personal airplane, or I should say airport. Let's see here. What do you think about fat transfer for acne scars? I showed a really killer result last week about that. So I love it for the right patient. It should be the right patient, the right area for the fat transfer. If it's like this area, the temple area, that's fine. But some people want it in the lower part of the face. Not a great spot there. Let's see here. Does Bellafill fill in scars immediately? It's not, a bit of it. It swells up a bit, and that's some of that cow collagen. And that cow collagen goes down over the course of really 30 days, though. Maybe a little bit, like a few days, a few weeks after that. But then 20% of the Bellafill stays there, and then it regrows over the next 6 months to even a year later. So that's why you have to be careful not to overshoot it. But the way I do it, I'm never like overdoing it. As I inject it, I expect it to go down. I do so much of it. I have it in my own face. I'm just very, very comfortable with how I do it there. What's the main difference in treating different types of acne scars in a person of color? Really good question. Past Bedtime is asking that. What's the main difference in treating acne scars in people of color? Well, the main thing is that we don't want to use much heat or much energy. And instead, we have to actually use our hands really with manual tools like doing subcision. If it's rolling scars, you do TCA Cross for these deep ice pick and boxcar scars. You may have to do volume replacement also. So there's a few different other steps that you may have to do. Sometimes in patients, like if it's one or two especially, you could actually go pretty aggressive with like an ablative CO2 laser, really remodel a lot of that scar tissue. That you still likely need to do subcision and volume, but you may not have to do as many steps. It may not take as long because you could go pretty strong with things and they heal and bounce back pretty well with the pigmentation. But there's another aspect of it though. A lot of patients who are Fitzpatrick 1 and 2 don't get the fast collagen response that you may see in Fitzpatrick 4 through 6 though, actually, interestingly enough, actually, a lot of times I'll see that people are so stressed about the fact that we may have to do more sessions with this, but I do see like a lot of times, especially patients who are otherwise healthy, who are making sure that their acne is under control, and they're really good with sun exposure. A lot of patients actually get a very robust collagen response in Fitzpatrick 4 through 6. I would say faster than my Fitzpatrick 1 and 2 patients. So, ultimately we may still get there. Like they do get the collagen production maybe, 6 months, a year later for the Fitzpatrick 1 and 2 patients when we go aggressive. But, it's kind of nice that sometimes maybe get a little bit faster results with lighter treatments in some of the darker skin types sometimes, because it just their collagen production may be good, or maybe their diet or something else is factoring in there. So they're really good with sun exposure, whatever else that's going on, and maybe years and years of sun damage for Fitzpatrick 1 and 2 just could also be an issue. So it's possible there. Yeah, David Lee's on here. David is saying, "Hi, Dr. Qazi. I'm your patient from Chicago." Hello, David. What do you think about PicoSure for texture? It's actually pretty good. It's just pretty slow for that. It's very, very slow for texture. You could do it a couple different ways. There's a way that's kind of more close to on label, which is pretty slow. That maybe somebody, someone may be comfortable doing. In some patients, though, I could push it just a little bit, and it works really well for some of like the mild superficial texture. And it depends though if it's really needed though. Maybe there's other options instead of that. Havana is saying, "Where in California are you?" I'm in Newport Beach. Thanks so much, Travel Vlog, for saying that. Thank you. Let's see. Ganesh is saying, "Doctor, after doing microneedling or radiofrequency microneedling or CO2 for first few days, the scars are looking very less, but after some days, it's like no improvement. Why is this happening?" Good question. Okay, so first of all, there's always like a little bit of this micro swelling that occurs, and sometimes it just showcases that there was some fat loss, that the scars basically do need some volume, and that's what you liked. You like that swollen look. You like the fact that there was some volume in there. And then you see that swelling goes down, and you get discouraged because you start to see still the atrophic area. The thing is though that the CO2 laser doesn't work like the way people are doing it typically is more like a fractionated form of it. What they're trying to do is stimulate collagen production. That's a very, very slow process. What I do with it is that, but then I also try to do it so that I'm working on the edges of the scars, and I work on doing things like TCA Cross, Subcision, volume replacement. So I'm able to sometimes get faster results in terms of not fast, but like in terms of like several months out, than a lot of other practices without doing as many treatments, because I combine multiple different modalities under a single session. Like this case, we couldn't just use a CO2 laser in this case. Like I did do a little bit of it in some edges, but actually what I ended up doing was I did TCA Cross, I did Bellafill, and we did some Subcision. And then we did some laser. But if you look at how deep some of those early scars were for him. Those are like pretty close to the muscle. Like you can't just go laser that down. What are you going to do with that? You're not going to be able to heal this patient's Fitzpatrick 4. He's not going to heal well if we did that. So going underneath, picking up that scar tissue, that's the stuff that actually ends up working. We don't want to overheat the skin, actually, especially in the temple area. It's not an area that works with healing like really rapidly. You can't use like high heat. And I see a lot of people do that kind of stuff. I see a lot of doctors out there that will showcase that they went really aggressive in a lot of different spots. And the temple is an area you will run into a lot of problems if you do that. My patients over and over will tell me that the doctor told them that they just have to go like max settings. They have to go under general anesthesia for the CO2 laser. And I don't believe in doing that. Almost never do I do it, really. Even in Fitzpatrick 1 and 2, it's like I'm doing it like still strategically around edges of these scars. It's like very precise. I'm making sure it's like done exactly where it needs to be done. I don't believe in like bulk heating the skin like that. So I think what you may find is that these practices where they're using like this fractionated form, where the idea is basically, for those who don't know, basically the fractionated form means that there's a bit of a gap when they do the laser. So they do the laser and the beams are kind of just gapped a bit. And let's say this is the tissue, right? So it's like basically touching the skin like this. The beams are here. It's evaporating some of the water in the skin. And what the concept is that it's sort of softening up the edges a bit, but it's also the idea is to help the scar rise over time. That's what basically the pitch is. Basically, that over time you're going to stimulate some collagen. You're going to keep on repeating this, so it's going to keep on rising over time. And that's why that patient or that person on here was talking about how they combined it with radio frequency microneedling. So what they did was they did CO2 laser, and then they basically did radio frequency microneedling because they're trying to trigger more collagen production. That's the thought process. That's what like people were pushed on. That was basically like the gospel for so long. So many people were saying, you got to do it this way. You have to do it this way. You got to do CO2 laser, radio frequency microneedling. You're going to hit multiple layers. You're going to stimulate more collagen. But what ends up happening, though, is that almost really, especially for a lot of scars, they never really see that rise that much. You just don't see it that much. You just don't see that much of that rise. And it's like, discouraging for people because it's like confusing. It's like you thought that the laser was supposed to just like ablate the sides and like that smooth it out. But the way that they're doing it and like the way that they understand it is totally not the way it's supposed to be for scars. Actually, that's actually true. That's the actual real truth. It's not actually for scars. And for someone like me, and like I sympathize for these patients that are on here that say they did 6 sessions, did a bunch of sessions of this stuff, because I did that too. I got like suckered into like this package deals of 6 sessions of like a combination of Fraxel with microneedling. Way back in like 2003, 2004 or so. And it was like useless. I was really happy the first time. I remember like being really, really happy for about 2 weeks. I thought this was amazing. It was like the greatest thing in the world. This is why everybody was talking about laser. I can't believe I didn't do this before. I didn't know about this before. And it turned out that like it just wasn't the right way. And the way the guy was describing it was exactly what the same way that people today 23 years later, 22 years later, they're still saying the same exact nonsense that they tell you that, oh, you just have to do this fractional blend, just keep on doing it with radio frequency microneedling, blah, blah, blah. And eventually the collagen is just going to rise and rise and rise. And it's not true. It's not like that. Like, yes, it can improve somewhat, of course, but like, it depends on the kind of scar you have. It depends on like, a lot of different factors, how thick the edges of these scars are, all sorts of different factors. And so this idea, like this blanket kind of concept that somebody also was saying that Halo didn't work for them, it's like a rolling device, Fraxel, all these things. There's these rolling devices, and they're not distributing the heat in an appropriate way for scars. And instead, what ends up happening is you got like really just, some texture that's improved, but the scars are still there. The scars are still really visible and obvious there. Let's see here. Gigi is on here. Gigi is saying, if you're on the fence, book an appointment. I could cry at how much my scars have improved. I appreciate you so much, Gigi. Thank you so much. So I appreciate you. She's saying that there's no pain whatsoever, and I really thank you so much. It's worth flying down there. I flew from the Bay Area too. Thank you guys. Thank you. Appreciate you. If you guys could, all my patients are on here. If you could just leave a review for me, I'd really appreciate it. Thank you so much for that, by the way. Michael Margaritas is saying, hi, Dr. Qazi. If you had to pick one approach, which do you think is the best to improve depth of scars? Probably subcision. I mean, it's just like, the thing is that it's so valuable, so important for the right kind of scars. It's so important. And even I had a patient at the end of the day right now was just doing actually really a lot of cellulite, actually. Interestingly enough, I do so much with cellulite with Subcision too. It's actually one of the things that like I think really was like, it was also just like, it was done poorly in this country because they were just insisting on like ultrasound devices. I used to have these reps that would come by and insist that like you just have to do like this ultrasound cavitation and blah blah blah. And, as soon as you open up a practice, they're just like they're bombarding you with random stuff, and they start telling you. And like I was like really like kind of innocent about a lot of stuff. I was thinking to myself that all these other doctors are telling me to go get these things, and I was like looking at it, this doesn't make sense. It's like stuck and it's like really pulled down over here. Clearly, we have to break this up. And so I was just breaking up the cellulite but putting a little bit of volume in. It was like amazing. So I realized that again, a lot of stuff was just like wrong. That they were saying the cellulite stuff, and now we started to learn now that like yes, you do have to manually break up all that cellulite. So same thing with scars. So subcision is one of the most important things, and then volume replacement, really critical things there. Can you do subcision without microneedling after? I do it all the time without microneedling after, all the time. And thank you so much, Gigi, saying again that there was no pain whatsoever. So for those who want to join, who want to schedule an appointment, go to my page, drqazi.com, and you can schedule it directly on there. We could do virtual consultations. Most of our patients come from out of state. We'll be happy to help you with that. And then also for my patients that are on here, appreciate you guys so much. Thank you so much for still sticking around for the community and helping people out, even though you've moved on. It seems like for like your improvements and like it's just been it's awesome to see you. Really thank you so much for that, and just answering some people's questions when I couldn't get to them. So thank you so much for that. Srijan is saying, do you recommend flying out the next day after Bellafill and Subcision, or is waiting a bit more recommended? It's completely up to you. Most patients do just leave the same day or the next day, to be totally honest with you. I got filler in my temples and I have 2 small bulging veins on my right side. Is this normal? Depends on how long ago. It's it's possible that there is a little bit of blockage there. So not in terms of like compression, like not in terms of like an occlusion, but maybe a compression. If it's relatively soon, I'm not sure exactly. Allie's saying, I scheduled my virtual consultation. I'm very excited to see you. Look forward to seeing you. Look forward to seeing you really soon. A lot of my patients, actually today, this patient, she's been following for more than a year. I think almost 2 years, she said, basically 2 years since I first started doing this. And really from the beginning, I know she did too, because she was mentioning things I said way back when I was only just, just a few people were on and things like that. And it was really nice, actually. And she finally came in, and after all this time, and we're going to, she's going to get an amazing and beautiful result. But it was really nice, actually. So I really appreciate all of you guys that are on here and that have built like a strong community too. Really do. And I will see you again tomorrow. Dominic's saying, Doctor, I really enjoy your videos. It's amazing to see how people improve their lives. I appreciate you too. Thank you so much. And let me answer these last 2 questions here. Are there any disadvantages to performing filler before a phenol peel? Does order in general matter? Typically, I do volume afterwards, especially if it's more like a temporary filler, because I want to know exactly where that the scarring is. But it's okay. We could, I just would like, let's say, I wouldn't want to like ideally do it right beforehand. But if you have it in there, we could work on and figure it out though.